So another gadget that I like to use for patients to make them aware they may or may not have sleep disordered breathing problems is to measure their oxygen saturation and their pulse. This is a LED as well as an infrared pulse oximeter. It's very simple to use. Basically, we're going to place it, well, you can place it on any finger, but ideally I think the index finger on the left side. For female patients, we want to make sure there's no nail polish, you don't have any of that, right? So Sonia's been our volunteer for this. So Sonia, can I just put that for you? Right, so just place it and activate. And once it's doing the reading, it's important for Sonia just to rest her hand on her leg so it keeps it still and flat. And then this will record for us the pulse and the oxygen saturation. Why is that important? If a patient has low oxygen saturation or desaturating, that's a sign they possibly have some form of sleep disordered breathing. It's not a true indication, it's not a true diagnosis, but it just helps put the puzzle together. I normally ask my front desk staff to do this for patients, as well as take their blood pressure with a cuff machine. Very simple for anyone to do. The patients feel very privileged. They feel, wow, this is a practice that's a bit more holistic. No one else has ever taken my blood pressure when I'm at the orthodontist. And then when I explain why we're doing it and they return high readings, we then give them the Epworth sleep scale and ultimately ask them to come in for a consultation so we could possibly then refer them for a sleep study. So let's have a look, Sonia. So Sonia, as we'd expect, young, fit, healthy, 99. So what figures are we looking at? I'm happy with anything between 95 and 100. I'd be a little bit worried between 90 and 95, and anything below 90 I think needs immediate attention, because remember, this is peripheral measurement, this is the daytime use. Can you imagine what would happen at night when we're getting the actual apnea events? So one thing to remember, that patients who are smokers or patients with any history of respiratory dysfunction, respiratory disease, will also show much lower readings. And it's important that we work with the GP, the respiratory physician, the medical team in this regard.